What do you think are the strategies, right? How can we build a resilient brand, basically, even for like a medical clinic or like hospital, ensuring that it is remain unaffected by new competitors entering? Because recently, when I was seeing certain doctors, uh, like a dermatologist or like any doctor, like in HSR layout or in Bangalore, there is one clinic. In the next street, there is another like 10, 20 clinics, right? In so much competitive market, what they have to do, how they have to build their brand.
So one study which I was reading about this is, yes, clinics are increasing, healthcare is increasing. Even if, even tomorrow there is on every street there are about 10 to 20 clinics, healthcare gonna be the biggest market because every person will require healthcare in their lifetime. Like, maybe like if I start from the journey of a kid, from a childbirth to the old age, there are different set where we require healthcare, right? So to
Correct.
fulfill even the Indian population is increasing. To fulfill this healthcare need and healthcare, you can say, requirement or whatever, healthcare industry in India, there is a deficiency because
Mm.
lot of patient they are doing self medication. They are not going to healthcare. They are not going to doctors and clinics. They are going to Google. They are searching their symptom. Acha, theek hai. I have headache. I'll have paracetamol. So that is actually mindset of lot of Indians. Hence, like what happen is in long term, they are not understanding the bad impact on their health. So that's why tertiary care. India require more tertiary care. We require more cancer unit. We require more units in diabetes because India is going to diabetic industry. And if I talk about strategies, definitely one clinic, how they can be differentiator for other is because one thing I tell to our clients also, like you should think about one thing, that is serving before selling. Nowadays what is
Mm.
happening is the corporate hospitals, even the clinics, they are getting so revenue fixation in their mind, if any doctor is coming or any clinic is there, the revenue part is there, because they have invested so much into building a hospital, so much building into a clinic, so hence
Correct.
like that is like natural. But how, why
Mm.
they're forgetting one, what they're forgetting one thing is to serve the patients. So the hospital or clinic, like my one message to them is definitely marketing is important. The differentiator should be serving the patients first. It should not be making money. Because once you serve the patient in your communication as well, how you're communicating to your patient, how you're empathetic to your patient, that also will make much more sense in the long term. Apart from that, I've seen like lot of nowadays everyone is doing digital marketing and marketing in their capacity, whatever they are having budget with them. But I've also seen whenever a client also comes to us, they said like how many patients we will get or how many leads we will generate. So I always like tell them it's not about lead generation. Marketing is like definitely you will get, even if you are doing a simple campaign on Facebook or Google, you will generate patients. But it's about how you are empathetic about your patient, how you are converting those patients. That is more important. So there, like I actually work with their telecallers to,
Mm.
to have a empathetic tone with the patients, because in the end that patient is calling 10 clinics. Just imagine 10 clinics, they're asking, okay, kab ka appointment chahiye? Then you want that. And one clinic is saying, okay, tell me your problem. And then, communicating with the patient. Okay, you have this problem. Don't worry, sir or ma'am. We are here for you. You just our doctor is expert into this thing. And hence that conversation when they start doing with their patient is what will make an impact. And I think like nowadays a lot of doctors are not using YouTube. YouTube is a very important platform. Even I suggest, even if you are making one video a day, posting on YouTube initially, just for the education purpose. Because healthcare is not about promotion. In US and UK, there is there is no promotional activities. It's only education and informational content which they are creating for the patient. Hence Mayo
Correct.
Clinic and Leo, big brands like NCBI, they have research studies, they have like very good content on that, as compared to India, wherein The moment the clinic or a doctor or the hospital get into promotion, patient will start understanding, and hence, like, the views and everything start dropping. So that is, like, my understanding of how you can be differentiator is, like, you have to serve before you sell any patient.
Absolutely. As you told, it's right. Like educating them is like more important even before they come. If they
Yeah.
start making videos, right, on like YouTube or like Instagram Reels, like educating them so that people can find some value, and they'll be like, I have a pimple. I saw a dermatologist sharing
Yeah.
how to reduce my pimple. Okay, I've got some help. Now I'll go to that doctor if I have like more this thing, right? The trust is formed.
Mhm. Even,
Absolutely.
like, I've seen, like, lot of doctors, when they create educational content, people will start relating more to them because they are not talking for selling, they are talking for information. They are just giving, like, because in, like, because I'm a believer of, universe and manifestation. So one thing I've learned there is, like, if you want to get something, you have to first give. So in, like,
Correct.
I think it applies in each and every stream of the life as well. If you want more patient, first you have to give them something. Give them the valuable content. Give them some valuable information so that it can change their mindset, change their health habits, change themselves in a certain way. Only then they will become your believer, and they will definitely become your loyal customer in long term.
Absolutely, absolutely. Love that.